Hello, Exercises for Injuries blog readers. This is Rick Caselge. I'm just finishing off the question about the client with chronic shoulder subluxations. So I'm just going to go through 3 exercises, or probably more specifically 3 movements that I would give someone that ends up having chronic shoulder subluxations. So probably the first movement that I would end up getting them to do is some sort of rowing movement. And it all ends up depending upon the client on what they're able to do, on what type of resistance I end up getting them to do. If I get them to do it with the machine, pulleys, free weights, or some sort of other resistance device. So I'd end up getting them to do some sort of rowing movement in order to work on scapular retractors, rhomboids. The second exercise I would end up getting them to do is some sort of depression, so pushing down and back up to neutral, pushing down and back up. So working, kind of working the lower traps, lower trapezius muscles, and also kind of trying to inhibit or relax the upper trapezius muscles. I usually end up doing that exercise either using tubing, so that they can end up doing that at home, or I would end up using a pulley machine for them to work on that downward punch. The third thing I would end up getting them to do is kind of work on scapular setting. So activating their scapular muscles or the muscles around the scapula. So usually mid-trapezius, lower trapezius, just getting them to activate those scapular muscles and have their scapula in an active position. So those are 3 exercises that I would end up giving a client that has a chronic subluxation of the shoulder. So we ended up having rowing movements, so resistive tubing at home, pulleys in the gym, or free weight machine they can end up using in the gym, some sort of depression with pulleys or with elastic tubing, and the third is scapular setting, which they can incorporate into their exercises, or they can do it on their own as an activation exercise. So a lot of those exercises I end up going through in the core stability of the shoulder course. So if you're interested in that, I end up going through a plethora of exercises that kind of targets the shoulder when an individual needs to work on the core of the shoulder or their scapular stabilizers. So thank you very much for reading the blog and watching the video. Make sure you leave a comment down below on some exercise you use for a client with shoulder subluxations, and any comments on the feedback on the blog, please leave them below. And yeah, I just thought about it. I'll do another video on 2 things I make sure I avoid in the gym with the client with a chronic shoulder subluxation. So we'll talk to you soon. Stay tuned to the blog and take care.